Okay, so now moved on to de-escalation and negotiation in patients management. Can you all hear me? How about now? Better? Okay. So my talk is similar, based on the theme we have seen, and we'll show you some video. We'll ask for your comments, and then I'll give you my feedback and summary with some examples that we as ER physician can learn in terms of administering management, treatment. So that's the history. Same, you're familiar now that the patient wants to go home. He has got chest pain, he has been waiting too long, so he has to go home. And the physician who is working, so I'll let you watch video and then think about, on the background, we are working to convince the patient to have the treatment or the management and what skills as ER physicians we can utilize to help him. Okay? Now, different actors this time.
Assalamu alaikum.
Alaikum salam.
Mr. Hamza.
Yes.
I'm Dr. Amr, emergency consultant.
Yes, Dr. Amr.
I have been informed that you are upset. Sorry for that.
Yeah.
What happened?
Yeah, I'm here waiting. I don't know what I'm waiting for. More than 3 hours.
I'm sorry. Can I have a seat, please? Have a seat, please.
Thank you.
Okay, Hamza. Mr. Hamza, I have been informed and I reviewed your notes that you are waiting here for around 3 hours, that you developed some chest pain 6 hours ago, but you are fine now. And the doctor who examined you ordered some blood tests to make sure that everything is okay.
Yes.
Yes, is that okay?
But I'm waiting more than 3 hours for this, and I cannot wait anymore. It's too much time. I can leave.
I'm sorry for that. I appreciate your patience that you stayed all this time. Mr. Hamza, I want to tell you what we are waiting for. We are waiting for a blood test to make sure that you don't have any serious problem in your heart. This blood test called troponin, which is, if it's elevated in the blood, means serious problem. I hope it will be fine, but we want to wait for that.
Thank you for your concern, doctor, but I cannot wait anymore. I need to leave, please. I cannot wait. I didn't get water since 3 hours. There is no water here. Even when I'm asking anyone to go out, they told me just wait, we will call you. And I mean, more than 3 hours, nobody called. And I'm waiting here, no food. My wife and my son, they are waiting me. And
I'm sorry,
I cannot do anything for them.
I'm so sorry for that. I can understand your concern or concern. I will try my best to try to solve this concern. For food and water, I will arrange for you. I'm sorry for that. I will call also the laboratory now to make sure that the blood result, the time of the release of the blood result, and I will come after 10 minutes to inform you. Sorry for waiting all this time, but I'm sorry for that. But you know that we are caring for you, for that we don't know exactly what we have now. We want to make sure that you are safe, that we should wait for this blood test to make sure that you don't have a serious disease which can affect your life.
Too much.
I hope no, but it can.
Nobody tell me that I will wait that much of time.
I really sorry for that. We should wait for the blood test to make sure that you are okay. Don't develop any serious disease after that. I hope that that the result will come okay. And as you know, that as I reviewed your notes, and I realized that you don't have any background of any disease, serious disease.
But I cannot wait. I cannot wait. I need to go. I cannot wait. I need to go.
Sorry for that.
Even my mobile charger is running out.
Yeah, no charge.
No charge.
Sorry. I think I can help you on that also. I will try to search for you any charge for that.
Thank you, Dr. Ahmed.
But my concern is that we wanted to wait for the blood test to make sure that you don't have any serious disease. Okay.
What is the serious problem for me?
Okay, our concern is that about if you develop any heart attack. Do you know heart attack?
Yeah.
That something serious can affect your future work or capability to work. So we want to make sure that you don't have this serious heart attack. Okay. The blood test we are waiting is called troponin, which is heart enzymes, which can be elevated if you develop any heart attack. But we hope that it will come negative, which is normal. That at that time we will inform you what's the next step. How can we refer you and arrange for another appointment in outpatient clinic? Okay.
Okay.
Okay. Sorry for waiting all this time, but this is all for your care.
Okay. Thank you. So, thank you, Dr. Ahmed. Thank you
Thank
for
you,
your
Mr.
explaining.
Thank you, Mr. Hamza, for understanding.
Thank you.
Okay. Thank you.
But we do come across this in real life, isn't it? So we'll have a discussion. I've got about 14 minutes. I'd like you to tell me, what did you think about what skills this emergency physician utilized to de-escalate and the situation, and what could be improved? Okay, be specific. You can't comment that he's a bit muscly, or he's a bit short or tall, or handsome, or so be specific. What is the skill that you have seen, and is it good to practice? Maybe use the mic so everybody can listen to you. So raise the hand and use the mic, please. Okay, but just
we apologize very well. It's a good thing. We'll go on apologize. Next thing we did is we ensured that the diagnosis would be addressed. And we record and address the concern. As the patient was getting a bit anxious or aggressive, he did not reciprocate. He kept it on. And he kept his food. He just did not show any aggression for us. That's a good thing.
okay, excellent. Lot of points. Give somebody else a chance. So you see, acknowledgement, empathy, sympathy, and he had a listening ear and apologize. He said about 5-6 times, "I'm sorry for this, sorry for this." So these are very good key points. 4 or 5 mentioned. Anything else that?
I will just discuss with the staff the sitting movement and the volume of both the private.
Okay, a good point. Privacy.
Patient can frustrate his anxiety and concern easily. This is not other patients that could
Because the time is limited, just mention the key points. So privacy is important. And anything else that you have noted, or would you like to recommend any change for the next video short? Okay.
First of all, if we go back to the previous lectures, there's a mistake that happening here that the patient didn't even know what he was waiting for. From the area of the lecture, we understand that the patient should be informed about what the investigation and why he's waiting for this investigation.
The key skill that physician used is apologized and explained. But the problem was, yes, it was a lack of communication in making aware about the waiting time. Any other key skill that he should have used? Okay, so we got 10.
Something positive. One of the things I noticed with Rahul was showing his hands all the time, which is actually apparently supposed to be honest. So if you want to hide something, to have in that way with this. And this is based on certain evidence that it's outside of medicine, presumably, but there's a fair amount of evidence that suggests if you show somebody your hands, you're more trustworthy automatically. And Amr was doing that all the time, which I was quite impressed by, because I'm not good at this kind of thing. Most people can probably tell that. But that was a very good demonstration, which I'm trying to implement.
I will discuss in the next 9 minutes, reinforce the key qualities for de-escalation, and then I'll share with you some examples. I think we'll learn better with examples. I have been in this trade in emergency for so long, I can share with you example about clinical, non-clinical. In UK, in my job in Wales, I used to do a grand round on claims and complaints twice a year. And it used to be loved by physicians in the hospital and used to be a packed hall because we learn from examples, we learn from mistakes. Okay, so coming to the video, I think you highlighted the key skills. You need to be sympathetic, empathetic, listening to the patient, and apologetic. When you apologize, it doesn't mean that you are apologizing for the mistakes. You are apologizing for the delay. And sometimes you start conversation with the apology, and patient do calm down. You know, when you say, I'm very sorry that this has happened. In our real life, things changes almost 180 degrees. Not always, but it does start with the conversations. So what Amar could have improved, towards the end of the video, he said, thank you, Tropony. He could have summarized, look, we have discussed 5 minutes now. You are going to wait for the results. Is that okay? And I'm going to speak to pathology lab to get the results, get the timing for the results. And I'll get a mobile phone charger for you. I'll get some food for you. Although he may have mentioned during the conversation, but because he was anxious, angry, so he might not remember. So his key areas were, what were the key concerns that he had? One was the food. Second? So waiting time, phone charger, and his family waiting. So these were the hidden things which was making him angry. And remember, patients come with a hidden agenda. Sometimes the waiting, he's angry because the blood test is not ready. But when Amar explored and explained the importance of blood test, food, drink, and he calmed down. In reality, it does happen. Not always, but if you address the hidden agenda, patient do calm down. So summarize is quite important, particularly in the heated discussion. At the end, you summarize. That also reminds a physician to do things, and also for the patient to wait and think about. So summary was the important that Amar could have done. Otherwise, when we made the video, we made 2 videos. One was that the nurse comes in, doctor, can you do Dharma form for this patient? And the physician goes to the patient. He says, okay, you don't want to wait. Are you sure about that? You understand the risks? He said, I understand. So he signs the Dharma form and leaves the hospital. The second video that Amar did was actually exploring hidden agenda. What is the reason that he come in? And you will, I think Ashid highlighted in the beginning that most claims and complaints happen due to communication errors. You might have understood the term underperforming doctors. Do you know about it? And do you think what is the commonest reason these doctors are labeled as underperforming doctors? It's not the lack of medical knowledge. This is to some extent, but it is the professionalism. It is the communication problem. That's why Salim and Professor Stephen has dedicated the whole day towards this workshop, so you can take home maybe 2-3 key messages and that you can use in your practice. for your own benefit and for the patient's benefit. So I'll share you 2-3 examples, and then my personal examples, one here and one in UK. My third baby daughter, she is nearly 18 now. I took her to the dermatology clinic, and so I went with her, and I didn't tell that I'm a physician working. So there was a dermatologist and 2 of his associates came to the room, and they walked in, and he said, we know why you're here. So he started explaining, oh, this is acne, this is comedone. Okay, we'll give you a cream. And he just went back to the room and wrote a prescription. And my daughter was furious. She's almost height as I am. And she said she's not having his treatment. She's not coming back. So I took her to a private clinic. So there were so many problems in this consultation, no introduction at all, and no introduction of the team. And the outcome, not as a patient, but I can sympathize with my daughter, that she never wanted to see him again. And so she didn't go back again. So you can imagine you as a patient in emergency department, when we don't speak the language, we don't know about their cultures. I'll mention a few things about culture. So it's very important to be a skillful physician. You need good communication, and that will save patient hassle and us long-term hassle. Okay, the second example, as you know, my interest in vertigo, I think that could only happen by practicing in UK. If I had practiced in Qatar, I would have stopped on my first year. So what has happened here when I do the vertigo maneuver, a lot of time, halfway through I've been stopped, and patient says, oh, no, doctor, I'm going to die. And the patient says, doctor, what are you doing with my dad or mom? In UK, I explain to the patient, and patient comes in by ambulance, as they're having stroke. And they walk in with the ambulance guys, and I explain to them, look, this is the problem, I can fix it. And they go home unaided, the color changes. So that gave me confidence. But here, culturally, I don't know, people can't take the pain, or there is something different. So we need to be mindful of the local culture. So one of the skills you can use is utilize the family members in convincing the patient. Obviously, you take the consent of the patient. And some things are in particular culture that you need to understand. So you need to be, for example, Ashid mentioned, I was also told about EGY syndrome. I thought this patient is having MI, but one of these clever Egyptian specialists told me, no, he's having EGY syndrome. So you need to be sensitive towards the local culture. Because why? Because it will help you to approach patient appropriately rather than doing unnecessary investigations. So utilizing the family member is a useful thing. So I'll summarize the last couple of minutes about what skills we should use. So one is you need to be sympathetic to the patient. In the last video we made with Hamza, it was an interesting point generated. He was talking to the patient in our workshop, and the doctor was saying, great. Hamza said, I've got a chest pain, I want to go home. He said, great. And great 4 or 5 times, which we normally say. And at the end, he said, why are you saying great? I'm having chest pain and you are saying great. So, the words we use, the tone we have, remember you as a patient, if I'm telling my daughter's example, and he might be a good dermatologist, that's why he's a consultant there. But she said she's never going to see him again. And so just put yourself in the patient's shoes. How would you like to be questioned? And how would you like to be answered? It takes a bit more time. If we follow the nursery request pathway, sign Dama, that's it, one less patient. But he might come back again with MI next day. So remember, we all need to be sympathetic, empathetic, and honest. And use the family members in a treatment which you believe as a physician is good for the patient. Is that clear so far? It's a very short time, but if you can take home one message, that we all need to be sympathetic, empathetic, and listen. because sometimes there might be hidden agenda that you can only explore by listening. If you listen to Amr, mobile phone came towards the end in the consultation, isn't it? Maybe this was he couldn't talk to his family. And I'll finish my talk with not a joke, but it's a real story. And you can only explore by listening. So a patient I saw, not here in UK, the presenting complaint was back pain. So I took the history, all the red flag symptoms, and I said, okay, I'll give you some analgesia. He said, when he trusted my communication skills, he said, oh, by the way, I fell at home on a perfume bottle and it got in my back passage. So if he was rushing, he would have never told me that the problem is foreign body in his back passage. So I think be patient, and they will tell you things that they will never tell anybody else. Okay, thank you. That's the end of my talk.